Thank you for joining us today for what is sure to be a very informative presentation, Fall Checklist Insurance. My name is Janelle Johnson-Momani and I will be the moderator. Throughout the webinar, please type and submit your questions. At the end of the webinar, we will open the lines for questions, so please keep background noise to a minimum. This webinar is being recorded and will be available on HFA's YouTube channel. Today's presenters are Wendy Owens and Katie Verb. Wendy Owens, before coming to HFA, was as the principal investigator and project manager of the CHOICE project. She was the executive coordinator for the New England Coalition of Affordable Prescription Drugs, NECAPD, N-E-C-A-P-D. Her initial experience with the hemophilia community was as the advocacy coordinator for the New England Hemophilia Association. Wendy began her career in the private sector, starting and running several companies, including an advanced composite materials engineering firm with technology patented around the world. For the past 12 years, Wendy has been an advisor to the U.S. Secretary of Commerce and U.S. Trade Representative on information and communications technologies, services, and electronic commerce as a member of an industry trade advisory committee, ITAC 8. Wendy lives in the greater Seattle area with her family. Prior to joining HFA as the Advocacy Policy and Blood Sisterhood Manager, Katie Verb was a member of the Government Affairs team at the Toy Industry Association. Before turning her interest to policy and advocacy work and moving to Washington, D.C., Katie worked in Chicago for a nonprofit that educated and prepared women to run for office. She also helped found a nonprofit that provided educational and mentoring opportunities for women in the business world. Katie earned her law degree from Michigan State University in 2008 and has a BA in political science from Loyola University Chicago. Having a family history of hemophilia, Katie is excited to be working with HFA as an advocate for the bleeding disorders community. Thank you all for joining us today. We will discuss in today's webinar open enrollment, appeals and grievances, best practices. First up will be Wendy Owens.
Thank you, Janelle, for the introduction. I'm going to go through the process of open enrollment for re-enrolling in your health insurance plan, which is an annual event which allows you to enroll yourself and your dependents in a qualified health plan for the following year. It's something that we all have to do. It's something that for people with chronic diseases is particularly something we need to focus on in order to receive the best, correct, most affordable care that we possibly can. Next slide, please. So to do this correctly, the first thing you need to find out is when your open enrollment period starts. And then secondly, you need to find the right plan to fit your needs. Step one, pretty straightforward. Step two, a little bit more to it. Next slide, please. Often open enrollments for most companies and state organizations and the U.S. government happens in the fall. And open enrollment normally lasts approximately 30 days. And you can check with your human resources person for open enrollment start dates for your company, and you should be receiving information from them anyways in advance of open enrollment in preparation for the opportunity to select a new health plan if you need a new health plan, or you can stay on the one you currently have. The marketplace plans, if you are using a marketplace plan, the dates are November 15th, 2014 through February 15th, 2015. This gives you a larger window in which to enroll than the normal 30 days within the private sector. Often that happens. Medicare, as it says, October 15th to December 7th. And Medicaid, if you are on Medicaid, it is a 365 days a year open enrollment. You do not have to enroll only at a certain time. Next, please. When you start the process, and this is the step two of finding the right plan for yourself, you really need to look at your past history in terms of what benefits you've had and what have worked well, and then also begin to anticipate expenses. So you need to look at what doctors, therapists, and specialists you'll need the next year, how much you spend on prescription drugs, if you need optical care, and certainly anything about the dental care that you'll need. Next slide, please. Critical to the process nowadays in selecting open enrollment plan, a plan during open enrollment, excuse me, is to determine what your budget is, how much you can afford and when you can afford this. So what are the monthly premiums for the plan? What is the deductible for a plan? Is there a option for health savings account or flexible spending accounts? And you have to think about, are there any procedures or surgeries that you will need in the coming year? Often people will learn that they need a procedure or a certain surgery later in one year and realize that their deductible is going to be too high, or pocket cost might be too high.
And I don't know where this little, hometown.
And when they realize this, they may want to push it to the next year. So you'll need to think about whether you have advanced knowledge of any procedures or surgery you might need. Next slide. So to this end, there is a budget to be created. As you know, the ACA, Obamacare, has put limits on out-of-pocket expenses. Where this is positive, it also is something that can hit people with chronic diseases, in particular hemophilia, kind of hard early in the year. This year, for 2015, there will be increases. And these increases are something that will happen each year. And this year we're going to be at $6,600 for individuals, $13,200 a year for families. And so this is calculated using a premium adjustment percentage by the Department of Health and Human Services. So they actually have a specific calculation they use to determine overall how much the out-of-pocket limits will increase year over year. There may be some years when they do increase, and there may be some years when they are held the same. It just depends on what's happening with the economy. Next slide, please. There is a special category of health plans called high deductible health plans, HDHP. And they are the out-of-pocket limit on these high deductible plans are increased based on the consumer price index. So these are plans with lower premiums, so lower monthly premiums. So, and I'm going to give this simply as an example, maybe $20 a month in premium, but a high deductible. So when there are services required, your deductible that you would pay out of pocket may be $5,000. These plans must specify both the minimum annual deductible and a maximum out-of-pocket number to be considered a HDHP plan. So for the out-of-pocket maxes for these plans, they cannot be above $6,450 for individuals and $12,600 for families. The minimum deductible for these plans must be no less than $1,300 for individuals and $2,600 for families. If you want to have a health savings account, which we referred to earlier as a possibility for a cost-saving measure, you must have a high deductible health plan. And I'm happy to answer questions on that later in the presentation. Next slide, please. So, critical in this instance is to review. Once you start looking at plans, it's all about the details, particularly for people with hemophilia and other bleeding disorders. So you need to read the plan's options carefully. And I realize that this is an additional burden that we have in our lives where we have to go in and we have to look at all the information about these plans, but it's critical to what happens within the next year because you don't want to have things that you need not covered by your health insurance. Make sure you ask questions about the plan. Make sure you contact your HR person if that's the opportunity. You can even call the insurance provider to ask questions. And if you're on a marketplace plan, you can call, there's a number here, and you reach out and you can speak with them to address your questions. So I can't stress enough how important it is to look at the details of these plans, not just the general overview, but the specific details. Next slide, please. There have been issues in the past year or so that have come to HFA's attention where the providers at hemophilia treatment centers are not in network. So the treatment center itself may be in someone's insurance network, but the provider themselves is not. So you really need to check and verify that your doctor, your physical therapist, your clinic, and even the hospital that you prefer to attend or a facility you prefer to attend is in the network. Know those details as it relates to those providers. And you can call your healthcare provider. You can call the HTC, you can call the hospital, and you can verify whether or not they are in the network. But we are starting to see this problem, so we want to bring it to everyone's attention and put it you on high alert with regards to the issue of providers sometimes not being in the network despite the HTC being in network. Next slide, please. You also want to verify your pharmacy or specialty pharmacy is in network. There have been changes being made without patients knowing that the change is coming to which pharmacy or specialty pharmacy they are allowed to use under their insurance. Pharmacies do contract with insurers to provide the medication and the related services, and you need to figure out if your specialty pharmacy, you can keep that coverage. You can keep that pharmacy and continue to work with that specialty pharmacy and home care and your 340B that you prefer when you're looking at the insurance coverage that you are considering. Next slide, please. Also, we are hearing more and more about possible developments of formularies where only certain medications are going to be covered under your insurance. So please make sure to check that your medication that you currently use, whatever product that is going to be covered by your insurance company. And you can check to see if it's covered under major medical, under pharmacy coverage, and that's just a matter of how things are paid for and how it counts towards your out-of-pocket cost. And call, make sure you call. And it could be that you read through everything and you just simply have to have a longer-ish conversation to confirm what you need to confirm in order to make the right selection of a plan. Next slide, please. Durable medical equipment. If it's something that you foresee that you possibly would need, or if you have a child or a family member or loved one that particularly a dependent who may need durable medical equipment during the year, and even if you can't anticipate it, just make sure that that's also something that's included in your plan. Next slide, please. There are rules that are being put in place by insurers as cost-saving measures for such things as prior approval for medications, prior approval for specialists, prior authorization for any treatments you may receive. There may be a limited number of times that you can receive certain services or visit a certain provider. For example, they may limit the number of physical therapy sessions that you can receive after, let's say, a bleed episode. And you need to also find out what are the rules with regards to coverage if you need to see an out-of-network provider. Perhaps you're traveling, you're on vacation, and you need to see someone in an emergency situation and receive care. What are the rules there? What are going to be your costs? How is that going to work? Next slide, please. Oftentimes you'll find that health insurance plans will offer certain discounts. They may offer discounts on things like dental care and eyewear. They may offer discounts even on gym memberships. So just as you're looking through your plans, the potential plans, the criteria for selection may include, it'd be really nice to have one new pair of glasses each year, or maybe it's even every other year. It may be nice to have no co-payment when you go in to have your every 6-month dental teeth cleaning. It also may be nice to say, okay, well, I can have a membership at a gym and it can be discounted substantially and because of my health plan, and I can exercise or use the pool or whatever it may be. Next slide, please. So we wanted to point out and bring to people's attention something just to keep in mind, and this may be applicable to you and it may be not, but you'll need to determine this. There are two different types of plans: the fully insured plan and a self-insured plan. And in a fully insured plan, the insurance company is the risk bearer, and the premium cost, all risk, costs, and administration are managed and covered by that insurance company. In a self-insured plan, the employer bears the risk. Claims are paid from the employer's funds that are set aside under this plan. And in some plans, self-insured plans are exempt from covering essential health benefits. So those are the 10 categories of benefits that the Obamacare ACA requires that qualified health plans cover. And under self-insured plans, there's a possibility, depending on your plan, that the essential health benefits may not be covered. So you want to check to see if you're in a fully insured or a self-insured plan. Just please do keep that in mind. Put it on your checklist in order to find out. Thank you very much for your attention. I appreciate it.
Thank you very much, Wendy. Next up, we'll have Katie Verb.
Thanks, Janelle, and thanks, Wendy. So today I'm going to discuss the appeals and grievances process once you have your insurance, and if you find yourself having to appeal a decision from your insurance company or file a grievance. We're going to discuss the process a little bit and go over some best practices. First, I want to stress the importance of filing an appeal or a grievance. Insurance companies often make decisions at an extremely high executive level. They have little information about the specific needs of various disease groups, and filing an appeal or a grievance allows you to educate your insurance company about your particular needs, and it's the only way for you to receive a different decision. So first, what is the difference between a grievance and an appeal? A grievance is simply filing a grievance with your company to express concern or disagreement with some aspect of your coverage or how you were treated. An appeal is it could lead to a different decision, and it's also often part of a process. It's an attempt to get a different result to a decision that your insurance company has already made about your care, payment, service limit, choice of provider, etc. There are different protocols about appeals. They must be made within certain time frames, etc. Next slide. So the most important thing is to start early. As soon as you receive the decision, you need to begin working on your appeal. To start, you have to think about some of the reasons that you might have been denied. Next slide. One of the reasons can be that you were applying for something or a physician or a hospital that was out of network. If that's the scenario, then you must work to prove that you did not have access to a provider who could provide that specialty care who was also in network. Next slide. If the treatment is experimental, you must demonstrate that the treatment was medically necessary. That might involve getting doctor's notes. It might involve some research on your part, etc. These are just a few of the reasons that you could be denied an insurance claim and a few of the arguments that you can make. Next slide. You might be denied because your insurance company wants you to do something less expensive. Either they have a fail first policy or they want you to try certain treatments, and you must demonstrate that the treatment is covered for other patients in similar positions. Again, some research, doctor's notes, etc. Next slide. It's very important when you are participating or filing an appeal that you follow the specific protocol for your insurance company. Each company handles the appeals process differently, and you must know the protocol. You really would not want to be denied payment or denied a service based on a technicality if it's a very specific process. And also pay special attention to timelines. If they receive an appeal late, again, you really don't want to be denied necessary medical care and necessary treatment because of a technicality. If you look back on HFA's website in the next few weeks, we are going to have some of the different protocols outlined for the major insurance companies up on our website that can give you some easy access to knowing those protocols and some deadlines and some information. Next slide. It's really important that you create a solid case. Treat this as professionally as possible. Write a very professional letter that includes the claim number, the date of service, summary about the denied, your arguments, etc. Next slide. Also, this is as important as starting early and following protocol is document. Document everything. Write down the time and date of every single conversation that you have had with your insurance company. And you may want to do this just in general, as a general practice, because you never know if some of those conversations where you haven't had an issue yet, but those conversations might work or might be important to an appeal later. So my suggestion is that you document the name of every person that you talk to. If applicable, get their employee number. Take detailed notes. You really want to be able to come back if you have to file an appeal and say, listen, I talked to somebody 6 months ago who said this would be fine, if that's the case. So whenever you're dealing with an insurance company, document everything all the time. Next. Another thing is to be persistent. A lot of these things, even if they tell you no, you might have to come back again and again and again. We've listened to a lot of patients who have gotten kind of one-off contracts from their company where they've been allowed to use a different company for a year, or they've allowed a special allowance for a particular issue because they simply badgered the company. You know, it sounds not professional, but sometimes it is really just be persistent and really advocate on behalf of yourself and advocate for your needs. They really need to know over and over and over again what's happening, and sometimes it's easier just to grant the appeal or give you what you need than it is to continue the process sometimes. Next slide. So this is also really important too. Once you've filed your appeal or once you've gotten your decision or if you've registered a grievance with your company, it's really important that you let your advocates know, let your member org, let HFA know what's going on. On a national level, HFA works with regulators, we work with lawmakers, and we're going to begin to work in educating payers about the needs of our community. And it's really, really essential that we have your personal stories. We need to know what companies have policies that hurt our community. If we can't go to them and say, you know, we think that this is a bad policy, or we heard this might not be good for hemophilia. You know, we need to say specifically, we have 5 patients that have your plan, and this policy has harmed them. You know, they need specifics. A lot of payers need specific patient stories in order to change their policies. They need to know that 10 of their patients have had the same issue. Also, as I'm sure many of you know from an advocacy perspective, when you're dealing with regulators and lawmakers, you know, patient stories are essential to that. We say all the time, tell your story, tell your story. So it would help us as a national organization that if we have your stories as well, so we could be out there telling payers, telling regulators, telling lawmakers what's happening, what possible solutions are, and the solutions are so broad and so varied. They can be, you know, prior authorization laws in states. They could be regulation changes with Medicare and CMS. They can be simply having, you know, an insurance company change a policy. There's so many different things that can be done, but if we don't know, A, what's happening, or B, you know, some of the specifics of what's happening and where it's happening, then it's going to be really hard for us to advocate on behalf of you. Next slide. So again, let us know on what's happening. We can advocate in all of these different areas. Again, a very wide range of solutions in each of these areas. Legislative, policy change, regulatory change, a lot of different things. So please let us know what's going on so we can be better advocates for you. Thank you.
Thank you so much, Wendy and Katie, for that very informative presentation. I'm certain that a lot of the information was available through the slides. So in light of that, please, please, please let everyone who you know who has questions or if they have stories that they've only told to you, have them contact HFA with their stories, because I'm certain that they're not the only ones who are affected. Also, this webinar will be available on HFA's YouTube channel. So if there's someone who wasn't able to join us during the daytime, they will have access to it as well. And if you have a question right now, you can just use the raise your hand feature, and I will unmute your line, and then you can ask your questions. So we are opening up the lines for questions right now. All right, great. So there's a question, and it says, someone wrote in a question. They're asking, if I submit my question to HFA about my insurance company, will HFA follow up, or will they help me follow up? Wendy or Katie, would either of you like to answer that question?
I can answer that. I think it will depend on the situation, but we will certainly, I think it varies depending on how far along you are in the process or what exactly is going on. But we will certainly do everything in our power if that is help you or if we need to follow up. I think it will vary, but I think both of those options are certainly available.
Okay. Another question is for you, Wendy. The question is, if I miss my company's enrollment period, is there still a way for me to get health insurance?
That's a very good question. And if you are still with your company and you miss your open enrollment period, usually what they do is simply, if you don't request a change of your insurance, you just kept on the same insurance policy. So they don't drop you from the policy. But also your company's HR department should follow up with you and be all over that, making sure that you don't miss that. That is their responsibility. If you, for example, lost a job during the year and you no longer had insurance, at any point in time where you have a life-altering event such as that, you can then choose a marketplace plan. So there is that alternative right away and immediately after one of these events taking place.
All right, great. Well, thank you, ladies. Those were the only questions. It seems that a lot of the information was covered through the presentation. Please visit HFA's website, www.hemophiliafed, and you can submit your questions or you can find additional information. And again, this webinar will be available on HFA's YouTube channel. Thank you for joining us today. This concludes the webinar, Fall Checklist Insurance.